So actually, any success cannot happen without having a values which you embrace, and these values are the key drivers of your success.
Hello, this is Zach with the American Journal of Healthcare Strategy, and you are listening to the Clinicians in Leadership podcast, where we focus on empowering clinicians from the bedside to the boardroom. Today, I'm joined by Mina Gamil. Mr. Gamil, why don't you take a second to introduce yourself? Tell us a little bit about your experience and give us a little bit of a hint of what we're going to be talking about today, particularly as we dive into this project, the Pharmacy Communications Channel project. So tell us a little bit about yourself and tell us a little bit about this project.
Sure. First of all, thank you, Zakari, so much for your kind invitation to be part of this podcast today to share my insights with your audience. I would like to introduce myself. My name is Mina Gamil. I'm a specialist pharmacist based in Dubai, UAE, for the past 9 years. I'm American board certified pharmacist and pharmacotherapy specialty. Currently working at American Hospital in Dubai, UAE, since 2022. I have worked in multiple healthcare organizations in Dubai and in the UAE that shaped my experience to who I am right now. So I got involved in different patient care settings, from ambulatory to inpatient to critical care units, even in oncology setting, dealing with all types of oncology practice. I believe that this kind of exposure I had in my career got me to know more about the roots of how each setting operates. That what enabled me to come up with our project, which is our today's topic, the Pharmacy Communication Channels Project. So to get deep into that, so Pharmacy Communications Channels Project is a customized platform crafted from the deep roots of our pharmacy operations, a project designed to serve a dynamic and diversified pharmacy operations with the goal of enhancing workflows, fostering communications and connectivity among different teams, diversified teams, fostering communication and connectivity. So, in other words, if you would say that this project is designed to bring diverse teams with diverse communications types and needs from remote locations to sit together on the same table to communicate in patient care. So, if you would like to summarize it, this is how I would like to do so.
Well, Mr. Gamil, we're grateful to have you on today, and just I'm really excited to have you on because you have extensive experience in a variety of different settings. I mean, you walked us through your background. Pardon me. You've served and provided patient care in a variety of different settings, and then as that interactions and that experience has given you unique insights into the creation of this project that if you didn't have that experience, you wouldn't be as equipped to be able to serve and lead and help organize the project in the way that you have. And so so thank you for that and for the way that you've stepped into leadership and seen areas that can be improved. And I think that you've identified just some key things just throughout healthcare in general. Just I mean, working with diverse individuals, diverse patients, and diverse teams, and those teams have to work together in order for patient care to happen effectively and for patients to have improved outcomes. And so I think to get us started, you've given us a summary of this project, the Pharmacy Communications Channel Project. In the name of the project, one of the key words that identified is communication. And so, why do you believe that communication is at the heart of successful healthcare operations?
Thank you, Zakaria, for that question. So, in my opinion, I believe that effective communication can have a positive impact on the patient healthcare provider dynamic in numerous ways. So, it can allow patients to be better educated about their own health, and it can allow patients to be better educated about their disease and illnesses, and to have a proactive health and wellness strategies. So in that case, this will help patients to develop a comprehensive understanding of the current care strategies involving their health and also including acute health situations. So if you talk about the proper communication within the healthcare industry itself. We spoke generally about the communication in general in healthcare, but within the facility, within the healthcare industry, it prevents, actually, if you have a proper communication channels, it will prevent the transcription errors that happens during the transition of care. It improves the patient's care, prevents medication delays, missing doses, missing prescription refills from patient requests, and also keeps patients informed about any insurance delays. And sometimes, especially for quite expensive medication, it happens everywhere. I believe the same situation happens in the States. So that's why you need to keep the patient informed about what's happening in their critical medication needs. Um, so also another aspect which it can prevent medication errors. An error can happen due to wrong administration of the medication, wrong or insufficient communication given to the patient regarding the medication instructions, how to use, how to utilize the medication in a proper and effective and a safe way. So you can see that clearly in a high risk patients managing diseases and medications. As I have worked in oncology and also have seen some cardiac patients, if you didn't give the correct instructions and inform the patient about the mitigation strategies of side effects, the most common side effects about some serious drugs treating serious illnesses. So in that case, communication is very crucial also within the patient, within the industry. I believe also communication in general can help to drive a sense of trust between the patient and the healthcare provider, which can make it easier for the patient to adhere to the physician recommendation. Because if I communicated well, all the information has been conveyed clearly. That means that I will have a lot of benefits from that. It can be potential long-term benefits, such as reduced patient visits, a reduced cost, and also improved patient outcomes. Finally, I can see that if any miscommunication happens, it can like improper decisions about healthcare um, can happen due to poor and improper decisions. So you can just get an idea how communication is very important in healthcare industry, within the industry, and also with patients in healthcare industry as well.
Yeah, no, and I mean, communication's everything. If you can't communicate, then the your team is going to be left trying to think for themselves and making individualized decisions. And the patients are who have not, most of them have not had extensive medical training or extensive medical background. And even for those that have, some of those words are really hard to pronounce within medicine. And so how can patients figure out how to navigate this if the experts aren't communicating effectively, and then leaders aren't communicating effectively with the teams? That's a critical component just to the success of an organization and success of a teams, and ultimately the success of a patient improving that they're having that improved outcome. And so recognizing how important it is, there's unfortunately there you walked us through some things that happen if communication's not up to par. Just like there's errors, there's medication errors, there's dosaging errors, there's lots of errors that can happen, and those things happen still, even though we know the importance of communication. And so what are some common barriers that hinder communication amongst healthcare teams?
Mm. That's a nice question, Zakari. So, in my point of view, a lot of factors contribute to that. So, but on top of the list, I will give you three factors. So, the first one is diversity of the healthcare team. So, those healthcare team professionals, they hold diverse educational backgrounds. Each one of them may not be aware about how is the other team is delivering the patient care. Secondly, no proper documentation of all communications. That's why we are creating this project, because you don't know what happened on the other side. Specifically, in case of transition of care, as I mentioned earlier, from one healthcare team to another, which is a major factor to consider as well while transporting patient care communications among those teams. Finally, which is the dynamism and expansion of healthcare system at which you are working at. So it's very challenging for you to develop a system that operates in a dynamic pace to accommodate that progressive expansion of the service delivery. As I'm speaking about the expansion, we are already operating to have a new hospital soon. So we are trying to grab all the operations of the pharmacy of one location, which is the main campus of American Hospital. But on the other hand, we are also having the same communication system to be linked with the new hospital as well.
Well, Mr. Gamil's shifting just a little bit because I want to talk more about this project, the Pharmacy Communications Channel project. And so, um, every great project starts with identifying a problem. If you don't have a problem you're trying to fix, then what's the purpose of the project? And so, when you and your team was creating this project and kind of at the initial stages of this project, what specific communication challenges did you detect in your pharmacy operations that sparked the need for the Pharmacy Communications Channels project?
That's a nice question. I will give you an example of increased number of lost follow-up on patient requests, delays or missing service to the patient due to lack of communication or miscommunication, which happen frequently. This actually arouse on the surface. So those communication, which is happening from all the pharmacy settings, were like a bullet anyone can shoot in any direction. So in another meaning, so it was clearly seen in terms of emails sent on daily basis coming to the whole department email ID from different departments asking for various requests related to patient care. So each of these emails were difficult to track and also were difficult to respond to in a timely manner. So um, we can say that in another language, like a medical language, if you would like to, that clear signs and symptoms of miscommunication disease were there. So that flared up the need of this project, and which can be also acute, if you would say so, to that problem. So that's why I believe detecting the problem was the very first step to obtaining the solution, and that's how it all started.
Yeah, and I love describing I loved how you said the American way of describing it, signs and symptoms, but that is such a key thing. If you're not able to recognize the signs and symptoms and discern what those are, then how can you know even where to begin to fix the issues? And so I think that's a really helpful way to start it. So recognizing that there's that key problem, that's one key component to the success of a project is identifying the problem. Another thing that I think when and just in kind of what we've messaged back and forth and discussed previously is a understanding just workflow, the workflow within pharmacy operations. And so, what were key elements of pharmacy workflow that shaped the communication platform's design, that shaped how the project was implemented and pursued?
Okay, actually, that was very challenging. So, first, detecting the types of communications. So, you have a lot of teams communicated. So, you have at the first place to detect the types of communications and the teams involved in those communications. And you need to set a starting point and an end point of each communication and at which level, because you have different levels. Secondly, level of communication accessibility. There were a different level of communications of our department, which was classified into internal and external communications among all the pharmacy teams. So, related to the internal communications, we detected that we have a lot of functions which we need to fill. And that's why we started with the first channel, which is any pending prescription refill request. So we created a dedicated channel for that. Dedicated channel also for medication procurement. So any pharmacy member can place a procurement request through a dedicated channel, which can be tracked and updated in a timely manner by the dedicated personnel. So based on the workflow also, other clinical application channels, which is the most exciting part about the project. So can you imagine that you can convert communications into clinical application? So how was that? How did we create clinical applications out of communications about the pharmacist? So actually, we created two channels for clinical applications. One of them for the inpatient clinical care, and the second one for the oncology clinical care. As I mentioned, I worked in different settings, so that's why I totally have a different backgrounds. It made me aware about what to do and how to deliver each channel. So in inpatient care, we developed a special tracking system which will help to track and monitor the use of restricted antibiotics. That can help you know about the antibiotic resistance and a lot of programs going live everywhere around the planet to target the resistance happening from the misuse and abuse of antibiotics. So every hospital has already in place antibiotic stewardship program. So in order to monitor that program, you need to have some KPIs. So we developed the systems to track each antibiotic, which is restricted, needs an approval by a physician. It will monitor and record the starting and end date of each medicine, okay, which will help the clinical pharmacist to have an overview about what's happening in all the departments, the wards, what's happening, how many peptides we have dispensed in the medical surgical ward, how many meropenem we have dispensed, did we reach our target to limit the use of this type of antibiotics or not. Um, Secondly, which is the oncology clinical tracking system. So actually, when I was working at the oncology setting, we face patients that need medication education, but we don't know at what stage the medication was diagnosed. Is the patient on the same line or different line, or patient is shifted from another line? And what was the reason of treatment interruption or discontinuation? So all of these insights, when you have a starting date and when you have the refilling date, it will enable you and enable also clinician to get to know more about the effectiveness of the medication, especially the oncology, oral oncology medication in real clinical practice. On top of that, for also this type of channels and communication, a smart notification system was innovated, mapped with precision to reach the correct team or even a single user based on a workflow which we have created to keep as an involved team member aware about any request update in the system, or at least give an alert to a team member to take an action on this request.
Well, Mr. Gamil, another key component just to the implementation of a successful project or a successful project implementation is having a clear identity for the project. So you walked us through just identifying the problem, and how you did that. You walked us through just key elements of the workflow that you understood, and partially and largely because of your clinical experience. And so this other component, just talking about this clear identity for the project. So one, tell us a little bit about just why a clear identity is critical for the success of a project in general. And then, if you don't mind getting more specific and just walking us through how you developed the pharmacy communication channels projects, that identity for that project, and how it inspired engagement of the teams that it affects.
Okay, that actually was an important part in our project. So in the very beginning, when we started planning going for that project proposal, no one knows actually what you're talking about, and it's only you who can vision that in your mind. It's only you. So in that case, visualizing the project and giving it a clear identity was very crucial. So everyone takes your proposal for the project with seriousness. It can reflect also your vision about what you're doing, and gives a credibility about an inspiration also to anyone who's encountering the project, and something give you like a hint about that something big is being cooked. It's not just an idea that can work or cannot work. So a project logo was created, and the idea behind the logo, I shared the logo design with you, if you remember. Actually, it was created out of interconnected pathways. and there was a C letter in the middle of that logo to express the first letter of the word channel, to express to everyone that whatever your communication within the pharmacy, this project will link the two communication dots, not only fill the communication gap. A project slogan also was created. Um, uh, I made up a slogan which was centralized process, decentralized channels. So actually, this to reflect on the purpose of the pharmacy communication channels is a model of the communications which is built on it, which is a decentralized communication model, which is very important when we were studying the how which model of communication we can build the project on it. So decentralized communication model was the one which we selected, which indicated that each team is responsible to responding and communicating the patient's request at each setting. That's why we call it like that. So, careful design of the project identity, logo, and slogan conveyed a message to everyone, ignited passion and excitement about something great what was getting built.
uh, Mr. Gamil, you hit on this just at the end of your last answer to that last question, but obviously you can do all the research, you can understand the problem, you can understand the workflow, you can have a clear identity for a project, and you can launch the project. But if the people that are it that project is if the people that are using those channels, using that project in their day-to-day just workflow, if they don't use it and they don't use it properly, then that project dies. There's that it's not helpful and doesn't get, it's not of use. If it's not being used, then the all that hard work that you've put in the planning and the creation, identifying the problem, the building of the identity just falls to the wayside. And so one of the things that you and your team did was launched an internal communications awareness campaign. And so, do you mind talking about that, and what other strategies that you used to ensure that the pharmacy teams that were going to be using this project embraced the project's purpose and used it as designed?
Um, Actually, you got me right. So I believe that system, as you said, will not solve a problem alone, especially when it comes to communication and miscommunication. So because why? Because as we spoke earlier, communication is a very sophisticated and a complex skill. It's a human skill, not only a system that you will use and generate requests and follow up on requests. So my strategy was induction of self-awareness, self-assessment of each individual on communication skills. I wanted each one of them to ask himself a question: am I practicing the correct communication skills? What wrong beliefs do I have about communication? So, whenever a miscommunication happens with a patient or another staff, or even another healthcare professional in the hospital, that awareness campaign, which we launched, will hit the weak points of each individual and will initiate a self identification of the areas of improvements, if you'd like to say so, so that he or she needs to work on it. So, the campaign was designed in an educational and an informative way to educate the pharmacy staff who are actually your internal customer of this project, if you would say from a marketing point of view, to introduce the most effective communication elements, strategy elements of processing and executing a communication request, and also tackling common communication misconceptions among the team.
Another key component, just to do the success of a project being implemented, is after it's rolled out and after it's launched, it just the feedback and the evaluations, and being continuously evaluating it, and if there's any improvements or bugs to work out, then you're able to address that at that time. And so, how do you continuously evaluate and improve this system and this project post launch after it's been implemented? How do you see and evaluate if it's working, or areas that it needs to be improved?
Okay, that was actually clearly set upon the project proposal to the IT department for IT implementation. So we set before setting the KPIs, we set a clear and objective project goals. So why we are creating this type of project? Why do we? I mean, I'm speaking on their tongue. Why would we waste our time on working on the project? There should be a need. Okay, so we set that clear and objective project goals that convinced the team of the information technology department about the need of such project. Out of those project goals, we extracted the project KPIs, because how you monitor a performance without going back to the original goals of the project. So, um, which was actually coming under many KPIs. We set two types of KPIs, which is one of them is operational KPIs. The second one was because there is a clinical attachment of the project. We speak about the clinical applications of the project. So there is also a clinical governance KPIs of the project because it has a clinical attachment. So these indicators, KPIs, which was set and extracted from the project goals, which we set in the early beginning, is our monitor screen. It actually guides us to show if we are going on the right way, or maybe you need to make a U-turn and execute some modifications to take you back on track.
Well, Mina Gamil, we're grateful for your time today joining us on the podcast. And I think it's been extremely helpful just to, one, see how your clinical experience has allowed you to serve and create this project and implement this project successfully and change not just how your healthcare systems organize and communicate, but also as a result, you're improving patient care. And I think that is one of the coolest things to see. And I've just loved throughout this conversation the stress on the importance of communication, barriers that organizations may face when it comes to communicating, benefits that effective communication does, and that just the simply that a system alone is not going to solve a communication issue. You need to constantly be evaluating and constantly seeking to be improving. And just I think it's been really helpful as well to walk us through the background of this project and how it got started, the problems you identified, and then how you and your team are going about trying to address those problems. And so before I let you go, I just have one final question. This is maybe a little bit more of a broad question, but um, for other clinicians in leadership, for other people that are in similar positions as you and are wanting to build similar operational or communication solutions, what advice would you give to them? Having been through this process and the wealth of experience that you have, what is just some general advice that you would give to other people that are in similar positions as you are?
Thank you also for that question. My advice to embrace the values which hold up this project success. So actually, any success cannot happen without having a values which you embrace, and these values are the key drivers of your success. So the values which I consider the cornerstones in any achievement or success, not only my project. And firstly, innovation. So you can see a lot of innovative solutions to many problems in any field, which seemed impossible in the past. So actually, these solutions came up because somebody embraced innovation and they managed to come up with solutions. So innovation is very important and critical if you want to achieve something unique and something someone no one has came up with it before. Secondly, you have to get passion and belief about what you're doing, because if you're not excited and believe in what you want to achieve, no one will do that on your behalf. Passion is contagious and also can be transferred easily to anyone, and it's a major key to success. Thirdly, which is one of my key main characteristics of my character, persistence and strong determination. So whatever the challenges you face, persistence is what shapes you reach to your goals. So you always need to have that in your pocket while you plan to achieve any achievement in your life, and not only a project. And finally, consistency. So small steps, even if it is slow, but in the right direction, it can be your driving force and fuel to reach the finish line. So you should keep the momentum of your pace with consistency.
Well, Mina Gamil, I love how just you ended. We've spent this whole time talking about this project and this the implementation of the pharmacy communication channels project and how that has uh, changed and kind of revolutionized the communication within your healthcare system and just the benefits that have come from that. But I loved how you finished with just saying, "Hey, true change and true implementation and innovation of projects and leading well boils down to you're personally practicing those characteristics that you just walked us through. And if you aren't, if people aren't practicing those characteristics, how can in the small steps, like you just said, if we're not making small steps, how can we ever expect to make a big step? And so I think that is just a really, really helpful and a call to action for any other leaders out there that are seeking to do as amazing things as Mina Gamil has done and will continue to do. And so um, we are grateful for your time today and are grateful to have you on the show. And we wish you the best and are excited to see where you go next. So thank you so much for joining us today on the Clinicians and Leadership Podcast.
Thank you again, Gary, for the kind invitation for your podcast. I hope I added value to your audience and all with all what I have shared with you. God bless you. Thanks so much.